各位傳媒朋友早晨，多謝大家。
Friends from the media, welcome to the press conference on COVID. With us today, we have the Chief Executive and the Secretary for Education. They will first speak before the floor is open for questions. Please keep your mask on at all times and maintain social distancing in the room. Chief Executive, please. Friends from the media, members of the public, good morning. Today, together with the Secretary for Education, I will explain our anti-epidemic work with regard to schools. First of all, I'd like to thank school sponsoring bodies, school principals, teachers, staff, and parents for their support and cooperation the past 2 years. School learning is very important for our students, and they form an important part in the growth of our children. For full day kindergartens and child care centers, they help take care of very young kids, and this is especially important for families with 2 working parents. Class suspension was certainly a very difficult decision, and we have had to make this decision a number of times the past 2 years. In the midst of the 5th wave, on February the 22nd, we announced that the summer break for the 2021 to 22 academic year would be brought forward, and as such we could make up for the lost time in school. We decided to make this decision since in a school environment, a lot of students would gather and they would take part in various activities. Children only started vaccination at a later time. In April last year, the vaccination age threshold was lowered to 16 years old. For students aged 16 to 17, they started vaccination in April last year, and by June last year, they could receive the community jab. And this year, with the consent of the Joint Scientific Committee, children aged 5 to 11 could get vaccinated, and by December last year, the age threshold for receiving the Sinovac jab was lowered to 3. And as such, our students were not able to gain protection through vaccination before that. The Secretary for Education had hoped to resume classes gradually. We merely suspended face-to-face teaching, but schools have continued to provide online learning to students. So every time the pandemic eases, we would allow schools to resume classes on a gradual basis. Starting from September last year, or the beginning of the 21 to 22 academic year, students could gradually return to school. For certain schools, once they reach a certain vaccination rate, classes could fully resume. The requirement then was for staff members to receive 2 shots, and the same for students who have received 2 shots. 2 days ago, I announced our midterm assessment, and after the Easter holidays, schools can gradually resume class after April the 19th. Once class resumes, the vaccine pass will apply to all teaching and school staff as well as school visitors, and the requirement is for everyone to receive 2 shots, and later we would consider when we would require the 3rd dose. For secondary school students aged 12 to 19, 95 received one shot, which is satisfactory. 66% received 2 shots. I believe students aged 12 to 19 who received the first shot would gradually receive the second shot as well. For children aged 3 to 11, like I said, vaccination for those 3-year-olds only started last month. Currently, the vaccination rate is 58%. They received one shot. Only 11% received the second shot. The Secretary for the Civil Service is spearheading the vaccination program. The emphasis has been to vaccinate both adults and children. 4 dedicated children community vaccination centers are administering the community vaccine for children. I visited the Children Community Vaccination Center at Gleneagles Hospital. It is managed by the University of Hong Kong. The environment is relaxing and colorful. Staff responsible for vaccination would put on special caps in order to reduce the anxiety on children during vaccination. Meanwhile, outreach service has been provided to many schools, and at times our vaccination outreach teams could visit multiple schools in one go. We also have mobile vaccination stations. We also urge schools and organizations to make reservations with other vaccination centers or student health centers under the Department of Health. Quotas would be reserved for children at these facilities. Finally, vaccines could also be administered by private doctors, and schools who secure vaccination from private doctors would receive government subsidy. I urge parents to arrange for their children to get vaccinated as soon as possible. Vaccination can help protect children as well as other kids who engage in learning activities in school. If we achieve a high vaccination rate among students, schools could resume full-day teaching and organize more extracurricular activities, including sports. We understand that schools have been affected by our anti-epidemic measures, and through the Anti-Epidemic Fund, we have been providing support to individuals, and companies and schools were no exception. In terms of anti-epidemic equipment or supplies, they would be provided to schools. For government and aided schools, they were relatively unaffected since subventions would still be provided. For kindergartens, including private KGs and private primary or secondary schools, as well as tutorial schools, since they were made to close, subsidies were offered through the Anti-Epidemic Fund. Thirdly, for school service providers, these are not school staff, but these companies provide, or these individuals or companies provide services to schools, including school meal providers, tuck shop or canteen operators, meal box providers, school coach operators, drivers, nannies, providers of after-school interest classes. The total commitment across multiple rounds of AEF amounted to about $3 billion.
In the sixth round anti-epidemic fund, we recognize the efforts put in by the frontline cleaners. $2,000 per month for 5 months will be made available to them. We have neglected those working in schools in the consideration. So under the AEF, $200 million will be dispersed to cover 22,000 cleaning staff and security staff in tertiary institutions and other schools. I defer to the Secretary for Education to brief you on details regarding schools and the resumption of classes. Thank you, Chief Executive. Since the pandemic appeared in Hong Kong, the Education Bureau has been working in conjunction with the school sector and education sector and implement relevant measures. We have to observe the social distancing measures and to reduce the chances of cross transmission and to safeguard the health of the staff and students. We also have to have regard to the learning needs of the students and maintain their interest. People have different backgrounds, family background, and family different aspirations. So there are bound to be diverse views regarding the situation. So we have to bear in mind that between learning and teaching and the anti-pandemic work, we have to strike a balance. As Chief Executive said, this is a hard decision. The anti-pandemic work is a prolonged battle. Nobody could precisely predict how the COVID situation would pan out, although we have put in place all the appropriate measures. But as each wave is assaulting us, people's lives, including teachers' learning, would inevitably be affected. We are maintaining liaison with the experts. When the COVID situation is getting worse, we will implement the right measures to enhance the anti-pandemic measures and to reduce classes and activities. When the COVID is at its worst, we inevitably will have to stop the in-person classes. Over the past 6 months, we maintained half-day classes. Inevitably, it would affect the normal learning on the part of the students. While the in-person classes are suspended, the schools will resort to various means to help the students to learn at home online, to maintain their motivation, to achieve the purpose of suspending classes without suspending learning. The schools have learned a lot of experience. The Education Bureau is providing support in the way of the mobile app and other support to support the teaching staff. I'm grateful to the principals and teachers and parents for their understanding. While classes are suspended, online learning is going on, but learning should best in the form of in-person learning. We understand that parents and schools would like to have more time for in-person classes. They should not lose the learning opportunity because of COVID, and also the opportunity for interaction and healthy mental and physical development. The Education Bureau will review the situation. If COVID is under control and if the condition is right, we would be resuming the in-person classes. Like we have phased resumption and resumption by classes, by grades, and we would give more opportunity for in-person learning. The resumption arrangement would have regard to the safety of the teaching staff and the students. The schools will need to implement all the relevant COVID measures so that we can have a safe environment for the students to go back in. In terms of class resumption, we have to have regard to a number of factors like the latest COVID situation, the ability on the part of the students, whether the students are preparing for open examination, whether they have to transition to the next stage of learning and make preparation. And prior to resumption, we would give schools ample time to make preparation. The fifth wave is really unprecedented in Hong Kong. The whole society has been under tremendous pressure. The government has taken resolute measures to make arrangement for the summer break. We have brought forward the summer break to March and April so that we would have sufficient attention given to the battle against COVID. And we've also we are going to be converting the normal summer vacation time to teaching time, and that would make up for the time lost. In accordance with the latest COVID situation, on the 21st of March, the government has announced that all schools will be able to resume on the 19th of April at the earliest. We will observe the development and the vaccination status of the students to resume our classes in phases. First of all, primary schools and also international schools and kindergartens and kindergarten childcare centers will resume first. Secondary schools will have to wait for the end of the DSE core subjects before they will resume. When the core subject examinations are going on, the schools can still deploy resources for online teaching to be conducted. And the face-to-face classes will be on a half-day basis in order to minimize the risk. From our understanding from the education sector, the students and teachers would like to have full-day school life as soon as possible. But face-to-face teaching would involve a lot of activities and a pretty long time, including mask-off activities like lunch. We have to control the risk appropriately. Vaccination is the best protection for everyone. We respect children's right to education, so we're not asking the students to have vaccination as prerequisite for resumption of classes. But a higher vaccine coverage certainly would build up a better barrier against the virus and to facilitate the working learning ability. For 12 and 19, first dose coverage is more than 95%. We should push the second dose of vaccination. And for those between 3 and 11, there is a lot of catching up to do, and also kindergarten kids. They only started the vaccination at the end of January. The vaccination coverage is 60% at the moment, but before April, we hope that we will be able to bring it up to 90%. After considering all these factors, if the schools can fulfill the following vaccination coverage, then these schools will be allowed to have full-day schooling. First, all teaching staff, including teaching and non-teaching staff, they should have the second jab for health reason. They can be exempted, of course. Second, for those with we should aim to achieve 2 doses on the part of students up to 90%. If the schools cannot fulfill these criteria for full-day schooling, and if some classes fulfill these conditions, we will allow these schools to arrange for these classes to have a full-day schooling and the relevant activities. If the schools have fulfilled all the criteria, then the students can be arranged to have non-academic subjects like sports and music.
或者我呢度亦都講一講文憑試嘅安排。
I'd like to talk about the arrangements for the Hong Kong Diploma of Secondary Education examinations. Due to the pandemic, the face-to-face classes were suspended, and that affected preparations for the HKDSE. Even though electronic learning can make up partially for the loss of face-to-face classes, activities that require face-to-face learning or interactions such as experiments, group oral discussions, etc., these would inevitably be affected. The suspension of face-to-face classes affected the exam candidates, and as such, the Education Bureau, Hong Kong Examinations and Assessments Authority rolled out a series of measures, for example, amending the exam schedule, revising the grading mechanism for HKDSE. We have streamlined the assessment requirements for multiple subjects from 2020 to 2022, and we canceled the oral examinations for Chinese language and English language to offer greater flexibility for teachers and students. For this year's Hong Kong DSE, we will continue to consult experts based on the pandemic to assess whether it could be held on time, and our goal is to proceed with the HKDSE as scheduled from April the 22nd. Some candidates expressed concern that they might not be able to attend the exams if they contract COVID or become close contacts. Special exam arrangements would be provided for candidates who need to be quarantined or isolated. This is not a simple administrative decision, and it's also about safeguarding the well-being of candidates and exam support staff. We cannot ignore the well-being of candidates and the risks imposed by the pandemic. The HKEAA has a mechanism in place to fairly assess all candidates who could not attend the exams. As the pandemic somewhat eases, the EDB, HKEAA, and experts are considering the feasibility of special exam venues. We stress that the well-being of candidates and staff are our top priority. The past two HKDSE exams were held safely and smoothly with the support of all parties, and this is a goal we are working towards as well this year. Vaccination, at the end of the day, is the most effective way to prevent COVID and reduce deaths in this wave of the pandemic. We have been working in schools with schools to provide easier means of vaccination. We would like to thank parents, students, and staff who have been vaccinated, as well as the efforts of schools who facilitated vaccination. But now is not the time to let our guards down. We urge parents and schools to continue to facilitate vaccination so that everyone would receive 2 jabs, and this would create favorable conditions to reopen face-to-face classes. We received different views on the resumption of class and the HKDSE arrangements. Some parents were concerned whether the resumption would come too early, and they were concerned that students might be forced to receive vaccination, and there are calls to postpone the HKDSE exams and to provide special exam venues for all students who tested positive. The EDB will make a professional decision considering all these factors, and our goal is to maintain the well-being of the students while taking care of their learning needs. At an appropriate juncture, we will announce details on class resumption and the HKDSE exams. The floor is now open for questions. Please raise your hand and identify your organization before you speak. Please limit yourself to 2 or 3 questions and do not ask for questions. The lady in green in the middle, please. I'm from Phoenix TV. I have a few questions. Can you please speak up? I'm from Phoenix TV. I have a few questions for the Chief Executive. Earlier, the CEO announced that compulsory universal testing would be suspended. In terms of the use or strategy on the use of makeshift hospitals, would there be any changes? Some academics said the 6th wave of the pandemic is inevitable. Does the government have any plans to deal with a possible next wave, and it was said that in April, based on the circumstances, social distancing measures or restrictions could be relaxed. Are you wary of a possible rebound? What is the plan of the SAR government in this regard? Your questions were related to an announcement I made a few days ago in the aftermath of our midterm review. Compulsory or universal testing is one of our strategies. We have not given up on this strategy, and the mainland experts reminded us to adopt this strategy properly, since it requires substantial resources. So we have to think about the right timing. Experts agree that this measure should be adopted in the early phases of the pandemic in order to curb the spread of the virus. We saw that many mainland cities adopted universal testing early in order to identify positive patients and in turn curb the spread of the virus. The fifth wave of the pandemic developed rapidly in Hong Kong, and back then we did not have such capabilities, and that's why we could not use this tool during that period. Once the pandemic eases to a certain level, we would look to identify the remaining cases in the community and curb the transmission chain. By then, universal testing would be a feasible option. As to whether suspension of CUT have any repercussions on our current measures or facilities, basically there are no repercussions. Without these facilities, CUT would not be possible anyway. So suspension of CUT, well, we must continue to develop community isolation facilities. Having considered the views of experts, our goal is to reduce the number of deaths, serious cases, and we must reinforce the treatment capacities of the HA. And this includes the deployment of beds, the setting up of designated hospitals for patients, and the arrival of the mainland medical support team. And this would reinforce the HA's Tier 3 response capabilities. So our priority is to reduce deaths and the number of serious cases. And we must also focus on elderly people. Unfortunately, most deaths recently involved elderly people, and this shows there was a lack of protection at our residential care homes. So in recent days, we have set up a number of holding centers for elderly people so that those who were in stable condition would not need to occupy the Tier 1 to 3 facilities at the HA and instead stay in our holding centers. They would still be subject to medical surveillance, and once they fully recover, they can return home or to their care homes. We certainly do not hope to see the sixth wave anytime soon. If we see a new wave of the pandemic or a new variant, our capabilities must be stronger. So we would certainly not stop reinforcing our capacities simply because the pandemic is starting to ease. Since the fifth wave started, we saw the need to review many parts of our academic work, and this is our current assessment.
問題。
Next question, please. The gentleman in suit and tie. I'm from CCTV. The Annex C chairman, Professor Liang Wanlian, said that for Hong Kong to put the CUT on hold doesn't mean that Hong Kong is lying flat. How do you think the Hong Kong government should more scientifically tackle the COVID situation? Second, about the economic recovery in Hong Kong, the government has rolled out some of the relief measures for those who are really hit the hardest. Do you think that there should be more precise, more targeted measures to tide them over the difficulty, help them keep their head above the water? There are many shopping malls are still not reducing the rent, and people are really struggling. Are there any measures to urge for the private sector to take more measures? Two questions there. I'm grateful to Professor Liang Wanlian for paying a visit to Hong Kong and for offering a lot of invaluable input to Hong Kong. The work that we are undertaking is to have absorbed a lot of views from Dr. Professor Leung, the three reductions, reduce death, critical cases, infection, and the four focuses. We have to focus the resources. We have to strengthen the clinics and step up protection for the COVID patients. In response to media questions, Professor Liang confirmed or affirmed what we are doing in relation to the CUT, and this is not lying flat, according to Professor. That this is more specific, more targeted, more scientifically based, and we are deploying the resources to areas where they are most needed. Now, to put the mass testing on hold, it doesn't mean that we're not doing anything at all. On the contrary, we are adopting more specific and targeted measures to tackle this wave of the pandemic. Professor Liang Wanlian repeated yesterday that we should carry out PCR tests on a larger scale, and we should take full advantage of the RAT test to identify the full picture of the COVID situation. Towards the end of February, because of the capacity crunch, we suspended the CTNs, the compulsory testing notices. Last night, we have resumed the CTNs, and people in 10 areas are required to undergo PCR testing within a specified time. People may hold contra views, but we are continuing with the RTD operations to pick up the infected cases on the basis of the sewage surveillance. And we are providing a lot more household support for the infected households, in particular medical support, both Western medicine and Chinese medicine. And we have the link, the anti-coronavirus link, which is helping us to distribute the anti-epidemic kits. All these are on top of the effort to strengthen the treatment. The HA is working really very hard on a daily basis to cope with the situation. If you notice the 4:30 news conference, we have more than 11,000 infected patients that are under treatment. They have designated more COVID hospital wards, and they have specific designated COVID beds. And the number of people who are stranded at the A&E wards has come down dramatically. I mean, at its peak, there were more than 1,000 people who were stranded in the A&E wards. Now we have taken on board the experts' advice and tackle the situation accordingly. The second question is about economic recovery. Work has to be focused and targeted as well. The waves after waves of COVID caused the economic situation to suffer. We have 6 rounds of AEF, Anti-Epidemic Fund, and for the 5th wave, even this wave, we had 2 tranches. And also 2020, we had the ESS, Employment Support Scheme, and also the 2022 round of ESS. Third, in the budget, for 3 years in a row, in the budget, we do have a whole raft of relief measures for individuals and for enterprises, SMEs, and also the 100% guarantee loans and the reduction and waiving of a lot of fees and charges, and also the cash handout of $10,000. And earlier, we had the $5,000 consumption voucher and the recent $10,000 consumption voucher scheme. All these are intended to support the economy. When the cases are easing, the economy will come back. Now earlier, the economy did come back. The year-on-year growth of 6.4% was really encouraging. The jobless rate came down really dramatically. I am fully confident that when the 5th wave eases, through all the measures that I alluded to, and the premises will be able to resume their business, and I'm sure that we will see a return of the economic prosperity. You asked about the rental. The major overheads include the staff costs and rent, and also the payment for utilities. Now, with more businesses, they can buy more, they can expand their business. Now, through the ESS, we help the businesses to take care of part of the overheads, like the staff payment. In May, June, and July, for everyone that they hire, there would be a subsidy of $8,000 per head, and we're trying to secure, to safeguard these businesses and jobs. Now, for the utilities, what we can do, we have already done, like non-household water tariff, non-household sewer charge rates, business registration, whatever that can be reduced has already been reduced. The exception is the commercial rent. So all these years, I've been making a lot of pleas. I've rung up the developers through Reader, and this is time that we should be coming together. We should be rallying round. At this point in time, they should be offering some assistance. Like one of the major developers, they stopped collecting rent because some of the businesses didn't really open. That the best thing to happen is to have turnover rent. Now, for these measures, I really do commend them for implementing all these timely relief measures. I urge the big owners to come together and rally around, and we should do our bit. I'm sure that when this wave is over, when you come out at the other end, Hong Kong will be better.
Next question, please. The gentleman in green on the back row, please.
CMP. First of all, is reopening the border with the mainland still a priority of the Hong Kong government, given that the mass testing is now put aside? And is there a timetable for it? And secondly, about flight and designated hotels. Cathay Pacific said that due to Hong Kong's 40-day flight-specific suspension mechanism, they can only schedule one flight per route every 2 weeks, even after the government lifted the flight ban. Would you consider relaxing or even cancelling the current mechanism? If not, why? And about the quarantine hotels, we see that most of those hotels only have rooms in May. Will there be more hotels added to the list, and how many designated hotels and rooms can be provided in total? And lastly, also about the compulsory notice. Experts said earlier that there was actually little point in it as the infection surged across the city. So why the government has to resume the arrangements instead of relying on the rapid test? And what do you expect the effectiveness of it? Thank you.
There are a total of 4 questions. I try to answer them one by one. One is, of course, reopening the border with the mainland, or more accurately, is to secure some form of quarantine-free travel into the mainland, remains a top priority. This is not only the top priority of the Hong Kong SAR government, this is a top priority dictated by Hong Kong's social and economic development. Because Hong Kong prospers as a regional hub to a certain extent, or to a very great extent, is because of her accessibility to this huge mainland market and her connectivity with various parts of the mainland. So there is a very strong economic need for this sort of facilitated travel or resumption of travel into the mainland of China. It's also a social development need because there are so many connections amongst the people of Hong Kong with the mainland. There are people who are living in Shenzhen, working in Hong Kong. There are students living in Shenzhen and coming across the border to go to school, let alone there are a lot of relatives and between the two places. So as I can make it very clear that resumption of travel into the mainland remains a top priority. And my government will spare no effort to achieve that objective by meeting certain prerequisites. It is not possible to give you a timetable now because we need to make sure that the 5th wave will subside as soon as possible. And then we will restore some of the basis for resumption of travel, which we actually have reached a very advanced stage of discussion with the mainland authorities in the last quarter of last year. If you go back to check the record, we started some interactions or discussions with the mainland experts in September last year. And they came down to look at how we tackle the epidemic, how we put in place the infection control measures, how we did the border control at the airport, and so on and so on. So by December last year, we were actually very close to announcing certain arrangements for people of Hong Kong to go into the mainland. But unfortunately, this 5th wave hit us. So we will, of course, resume all those discussions once the conditions permit. The second question is about the lifting of the flight ban. Let me say it again. This is not a relaxation in border control measures as some people have put it. We are still subjecting arrivals, now Hong Kong residents, to very stringent quarantine requirements, which are no longer adopted in most parts of the world. We are requiring the arrivals, and by the way, they have to be Hong Kong residents. We are not allowing non-Hong Kong residents to come to Hong Kong yet after lifting of the flight ban. So these Hong Kong residents who wish to come back to Hong Kong, they have to be fully vaccinated, that is 2 doses. And prior to boarding the flight, they have to have a negative PCR test. And upon arrival at the Hong Kong International Airport, they have to undergo another PCR test. And if it is negative, they will take designated transport to go to a pre-booked designated quarantine hotel with a 14-day quarantine order But like other people of Hong Kong, there will be a discharge arrangement if they manage to have a RAT negative on day 6 and day 7, then they could be discharged. So this is very stringent quarantine requirements in order to ensure that we are keeping the virus out from our community under what we call the border control measures. Now, since my announcement 2 days ago, I received a lot of feedback. Yes, they welcome very much this lifting of the flight ban, or what I describe as a rationalization of our quarantine arrangements. But they point out two problems, as you have asked. One is whether there will be enough flights to come back to Hong Kong, because we still have this flight-specific suspension measure in place. That is, if an inbound flight takes in a certain number of COVID-19 positive cases upon arrival, then they will not be allowed to fly again for a period of 2 weeks. This is going to limit the number of flights inbound. I can only say that we know the problem and we are looking on how we could resolve this without compromising our border control measures. The second thing they need is, of course, a hotel, because we are not allowing people, arrivals, to isolate at home. They have to be isolated at a designated quarantine hotel. Prior to boarding the plane, they have to show that they have pre-booked a designated quarantine hotel in Hong Kong for 7 nights. I told you on Monday that the latest count is we had 25 designated quarantine hotels, about 6,500 rooms. We are working very hard. I hope to be able to tell you a higher figure soon. My colleagues are working with the hotels to encourage them to perform the role of a designated quarantine hotel. You remember earlier on, I have a webinar with the hotel industry, and many of them have come forward to provide a hotel as a CIF, a community isolation facility. But now that we have central government support and we have started to put in place all this fangchang with the CIF units, we will reassess the situation, and if possible, we will invite those hotels to transform into a designated quarantine hotel. So there will be a greater supply of designated quarantine hotels for Hong Kong residents who want to come back. Now, about the resumption of CTN, that is a compulsory testing notice yesterday, COVID-19 testing, both PCR and RAT, are equally important, because we want to know the epidemic situation in Hong Kong for public health purpose and for the purpose of devising public health measures. We want to identify as early as possible people in Hong Kong who are infected, but they don't know, because a large percentage of Omicron infected cases are asymptomatic. So it is only through testing that we could identify these people and suitably either isolate them or treat them, and in order to suppress the continued spread of the virus in community. So I was actually a bit surprised that some people, especially some people in the medical arena, are so skeptical about testing. Testing has been recognized as the effective measure from day one in fighting the epidemic, and I'm sure it will continue to play an extremely essential role in any public health crisis in future. So between the RAT, that is a rapid antigen test, and the PCR test, there is no doubt that the PCR test has higher sensitivity and is far more accurate. But at the same time, yes, because of the widespread of this Omicron variant, and we have accepted the use of rapid antigen test and self-declaration as a sort of positive case. But since we have the capacity with the ramped up laboratories in Hong Kong, I certainly think that we should be far more proactive and undertake more PCR tests in order to assess the situation. So this is what we are going to do from now on, because the capacity is available. And I'm sure we want to find out more people who are infected. And we also have a lot more isolation facilities and a very clear tiered mechanism to identify those infected who should go to a CIF and those who could be allowed to isolate at home. So we're working very hard. So I don't see why we should not do what we have been doing and doing quite effectively in the past 2 years. Thank you.
好，下一位記者提問。
Next question, please. A lady in pink to my right. TVB. The HKU team said that between endemic disease and dynamic COVID, dynamic zero, we have to pick a choice. What path are we going down? If we are going down the path of endemic disease, do you think we have sufficient capacity to look after the severe cases and handle the possible death cases? Now, if we go down the path of dynamic zero COVID, do you think we should have the mass testing? Now, we're going to have more variants coming up. And in your roadmap, how soon are we going to move towards endemicity? There are some policies that are not coordinated, like we have lifted the ban on the 9 countries, but we still have this circuit breaker system. And will this be tantamount to not changing the situation? Are you going to relax the circuit breaker mechanism as well? Now, the bringing forward of the summer vacation and the suspension of online teaching is the cater for the mass testing. Now, with the mass testing being put on hold, do you think that we have wasted the learning momentum? Do you think there would be room for the teachers and students to have longer summer holiday? Well, you have a whole litany of questions. I need more time to answer them. First of all, the Hong Kong U team has, over the years, been conducting studies, and they've been doing their modeling. I read their findings on a weekly basis, but studies remain studies. Academic projection remains academic projections. The reality is far more complex. Our policies will affect 7 million people, and the commercial operators. I don't think we can just rely on the modeling to devise the policy, although these would have a very good reference value. I've been saying, even to the experts, that we are taking reference to the modeling, and in fact, experts do have their own diverse views. Even our experts in the government do have different views, not to mention other experts. This is not a question of a choice between 2 paths. Now, we have to ask about the whole spirit, the whole purpose of this anti-pandemic battle. Now, we have one single objective, and we are setting great store by the public health and public life. So we should curb the pandemic. We should flatten the curve as soon as possible so that we can go back to normal. That's very much an objective of our anti-pandemic efforts. As I said, we are trying to achieve the maximum results with the minimum resources. And we hope that we will be able to minimize the impact that the COVID would have on socio-economic situation. In answer to the previous question, I said that opening border is one of the issues. So we have the objective of opening the border with the mainland and also internationally. After all, Hong Kong is a platform bridging outside and the mainland. We must have determination. We cannot be lying flat. We don't take our chances at all. Every single day we are working very hard to deploy the finite resources to areas where they're most needed in a scientific way. And we have to enhance and optimize the measures. Now, 2 weeks ago, we may implement certain measures, but after 2 weeks, if we stubbornly stick fast to the measures that we announced 2 weeks ago, that's not really the way to go. Previously, PCR was the golden standard, but today, even in mainland, we are increasingly accepting the RAT test. This is an enhancement measure. Previously, we had one single tier of treatment. Now we have 4 tiers, at least 4 tiers of treatment. And this is an example of constantly enhancing the measures. But our overriding objective remains unchanged. In January 2020, I mentioned fast responsiveness and transparency and so on. Now, the transparency remains unchanged. We do not really just look at the resources. Anybody who is affected or any businesses who are affected by the pandemic, we will not really just look at the resources. We will deploy the resources to help them. So we have to face up to all these issues instead of just having a choice between the 2 paths that you mentioned. Second, putting the compulsory universal testing on hold. How soon are we going to do it? We apply the same principle. Towards the end of the pandemic, if a mass testing will achieve the purpose, then we're going to be doing it. We will not be just looking at the resources. If we can achieve the objective, if we can minimize the impact on the economy, if we can reopen the border, then we would do it. But this is not the time we should be doing it, because the number is still, the COVID positive number is still high. And we are making preparation for all these makeshift Fangtown hospital. Now, when they're ready, we have the right condition. But even with the compulsory universal test, we will let the public know about all the arrangements that we will be putting in place. So people should not come away with any misconception. I have to put this beyond doubt. Given the current situation, we have put the CUT on hold. Our focus is put on treatment and the testing work. The second question, I can't see any absence of coordination. We're talking about 2 mechanisms. Circuit breaker is about the flight. The circuit breaker is also about the region. The circuit breaker is more stringent. We didn't do a lot of this, but in the 5th wave, the Omicron variant is highly transmissible. And these countries, the UK, the US, and France, they had a very high number of cases. So in order to protect Hong Kong, we have put these 9 countries on the circuit breaker system for the for these flights. So no flights can be flown to Hong Kong. If they experience certain cases, but without these ban on the flights from these 9 countries, it doesn't mean that we can't have the flight-specific circuit breaker. Now, if they have tested negative, they book the hotel. Now, for flights flying to Hong Kong, it's ranging between a few hours and more than 10 hours. And during the test and hold, if we hit a certain number, then a circuit breaker will be imposed. And we hope that they will be exercising more caution to adhere to the principle of Hong Kong to guard against importation of cases.
但係 兩個嘅措施並冇不協調嘅地方，甚至可以講咧係分層次咁嚟去管制外防輸入嘅工作。第三咧就係當日2月22號提早放暑假，可能其中一個原因嘅講法咧係話，如果做全民強檢咧，我哋係需要大量嘅檢測嘅場地，而好似投票咁啦，就學校係一個好常用嘅場地，因為佢哋嘅分佈好廣啦，各區都有，而且咧就地方比較寬敞，有禮堂，亦都有操場，亦都可能有停車嘅地方。
They could mobilize school halls, outdoor venues, etc. But that was not the reason by then. The reason behind the decision was that hundreds of thousands of students would have to go to school, and there will be heavy traffic. Our objective was to reduce the flow of people by asking people not to go out. If hundreds of thousands of students go to class every day, then we would not be able to reduce the flow of people. We talked about the continuation of online learning despite the suspension of face-to-face classes, but at the end of the day, online learning is different from in-class teaching. In the 2021 to 22 academic year, students lost a lot of learning time in school. That's why we made the difficult decision to bring forward the summer break, and students would be able to go to school in the after the summer break. So it was a very difficult decision, but the decision was welcomed by schools. The head of the Aided Primary Schools Association said class suspension can protect children from being infected since they would not have to take public transport, and he hoped that during the suspension period, vaccination rate could be boosted, and this is what we are doing. See you at 11 a.m. tomorrow. Thank you very much.